6 adults will have depression sometime in their life. This affects about 16 million Americans every year. The good thing though is that there is hope because depression is treatable. I will be giving you some healthy tips today of what you could talk to your doctor about, so stay tuned. If you or your loved one seems to be developing symptoms such as sadness, irritability, lack of sleep, lack of enjoyment of things that you used to enjoy, or lack of concentration, you may have depression, and be sure that you see your doctor about it. One thing to ask your doctor about if you or your loved one is developing depression symptoms is to check your vitamin D levels and vitamin B levels. Sometimes if these levels are low, they can lead to depression symptoms. Another thing that you could ask your doctor about if you're developing depression symptoms is to check your hormone levels. Childbirth, thyroid not working properly, or menopause. There's many different factors that could change your hormone levels, especially age or puberty. All of those things can play a factor in depression symptoms. Now, there is one solution to depression that is absolutely very effective, and it is exercise. I know a lot of people are not that excited about exercise, but it really does work. One thing that really helps is to reward yourself after exercising, keeping in mind that you will feel better afterwards, especially on the days when your energy level is very low. Those are the days that you need the exercise the most, and surprisingly, after exercise, your energy level actually goes up. And then reward yourself with whatever you'd like, a bubble bath, your favorite movie, your favorite TV show, or a good book, whatever you enjoy the most. That way, next time you need to exercise, you will look forward to it. Or at least to the end of it. There's a fantastic book about the benefits of exercise. It's by Dr. John Ratey. The book is called Spark. He researched the benefits of exercise for many years, and he presents all the data in this book. It is fantastic. One thing that Dr. Ratey mentions is that if you're trying to exercise to beat depression, what you need to do per week is multiply the pounds that you weigh by 8. This is the amount of calories that you should be burning every week. This ends up being about 30 to 40 minutes of exercise most days of the week. Medication and therapy, of course, are very efficient and very helpful with depression. The problem is that sometimes medications take a while to work, sometimes 4 to 8 weeks. And it takes a while also to find the right medication, so you really have to be patient. A lot of the times patients have to try several of them before they find one that really works. If you have tried medications that have not worked or have very uncomfortable side effects, ask your doctor about a pharmacogenomic panel. It's a simple blood test, and your doctor will receive a list of the medications that are genetically compatible with you. And sunshine is very, very efficient in helping fight depression. Be sure that you go outside every day, that you get a few minutes of sunshine every single day. Sunlight will hit your eye and produce endorphins that are necessary to fight depression. And social interaction, of course, is very necessary. The problem is that with depression, a lot of the times people tend to isolate themselves because they just don't like the way that they feel. This is the time where they need to be around people the most. That it's a good time to be around people that you love, people that love you, people that you trust and feel comfortable with, that will not judge you and will be supportive to you when you're going through these struggles. But try not to stay alone. Be sure that you reach out to someone, and it's very important to talk things out when you are struggling with depression. Keeping your gut healthy is also a very important thing to fight off depression. Surprisingly, most of your neurotransmitter receptors are actually in your intestinal tract. We do have some in the brain, but most of them are in the gut. So it's super important to eat very healthy, to stay away from junk food, stay away from things that have a lot of preservatives or coloring or MSG. Just try to eat as pure as possible, and keeping your intestinal flora very healthy with fiber and probiotics. Things like yogurt or kefir. If you are lactose intolerant, probiotic pills are very helpful. And sometimes people that are lactose intolerant actually do pretty good when they drink kefir. So be sure you talk to your doctor about those options. And of course, whatever you put in your mind definitely affects depression, especially if you're going through a very stressful time, a huge life change. it's really important to keep good things in your mind, especially things like music, TV shows, movies, radio shows. All of those things affect how we feel. And social media, be sure that you stick with things that are positive and uplifting and will help improve your mood and not bring you down. Dr. Carolyn Leaf talks a lot about how our thoughts influence every single part of our body, and it is very essential for mental health. Another really helpful book to look into is one called Feeling Good by Dr. D. Burns. He describes a method of journaling that he actually uses on himself sometimes when he's having a stressful day. And he helps his patients also learn how to journal properly to help switch the thoughts. What he describes is that on one side of the page, you talk about your negative thoughts. You write them down, whatever you're struggling with, whatever lie you are believing. On the other side of the page, you replace it with positive thoughts or with the truth. And this will help your brain switch the type of thinking and then will affect your mood in a huge way. If you have tried about 3 medications and they have not been effective in treating your depression, or the side effects are very bothersome, you can ask your doctor about transcranial magnetic stimulation. A lot of health insurances will cover this if a patient has tried about 3 medications that have not been effective. It is a pain-free method where a patient is completely awake. They can read a book or watch TV while the treatment is happening. Many patients have found complete remission for about 5 years of depression symptoms using this treatment. So ask your doctor if he thinks that this would be a good idea for you. Thank you so much for staying till the end of the video. If you found this information helpful, please share it with your friends. And always remember, be kind, worry less, and laugh more. Thank you so much and see you next time.